Добро утро, доцент Казакова. Чуваме ли се?
Чуваме се. Добро утро.
Малко да си усилим микрофона.
Чува се добре, вижда се, всичко е както трябва.
Добро утро, доктор Димов.
Добро утро.
Много хубав бекграунд.
Да, както ви писах и в чата, стана 8. Виждам, че първите автори, които трябва да презентират, са тук, така че ако искате, можем направо да стартираме.
Добре, колеги, можем да открием сутрешното заседание на медико-биологичната сесия. Dear colleagues, good morning. I would like to open the morning medical-biological section. So the first presenter in Bulgarian or in English?
Should be in English.
Hello, everyone. Actually, I have some issues with my camera, so I would like to ask if there would be a problem to speak without...
No, it's okay.
Okay, thank you.
На български или на английски представяте?
На английски.
На английски.
Да.
Well, the first topic is neuroimaging techniques and biomarkers in contemporary psychiatry. Representer is Katrin Ryutova. I'm giving the floor to the representative.
The behavioral disorders like schizophrenia and mood disorders are amongst the leading causes of disability. They typically occur at late adolescence or early adulthood among the working age population, which explains their negative socioeconomic impact. Also, these conditions present with high comorbidity rate with somatic diseases as well as with other psychiatric conditions, which in addition to the significant risk for self-inflicted death marks their high mortality rate. One of the significant problems in psychiatry is that the diagnostic process is primarily focused on patients' reports, behavioral observation, and the psychiatrist's ability to draw conclusions rather than to rely on accurate objective biomarkers. In other medical disciplines, clinicians rely on objective measures like blood tests and imaging tools, but in psychiatry, the diagnosis is mediated by subjectivism, which affects the reliability of the assessment methods. Another issue is that the standard diagnostic systems, which are the Diagnostic and Statistical Manual of Mental Diseases and the ICD, the International Classification of the Diseases, lack validity, which is evident from the ambiguous descriptions of healthy and abnormal behavior and the fact that most of the psychiatric illnesses are described as heterogeneous illnesses with high comorbidity rate. Another significant concern is that mental illnesses are categorized purely on their clinical manifestations without consideration for their etiology. So there is a need to extend the understanding of brain behavioral correlations and to incorporate the obtained knowledge into clinical practice with the final aim to develop more successful treatments. The translational approach in psychiatry encompasses a wide range of MRI techniques, such as quantitative structural imaging, voxel-based neuromorphometry, functional neuroimaging, and spectroscopy, which are widely used in psychiatric research. Typically, neurons do not have internal reserves of energy in the form of sugar and oxygen. So their firing causes a need for more energy to be brought in quickly. Through a process called a hemodynamic response, blood releases oxygen to them at a greater rate than to inactive neurons. This causes a change of relative levels of oxyhemoglobin and desoxyhemoglobin, oxygenated or desoxygenated blood, that can be detected on the basis of their differential magnetic susceptibility. Some of the significant brain regions which appear to be important in mental illnesses are the prefrontal cortex, the anterior cingulate cortex, the anterior insula, and the precuneus. The prefrontal cortex is an integral link between a person's will to live, personality, and the functions of thoughts. This brain region has been implicated in executive functions such as planning, decision-making, short-term memory, personality expressions, moderating social behavior, and controlling certain aspects of speech and language. The anterior cingulate cortex is associated with higher level functions such as attention allocation, reward anticipation, decision-making, ethics, and morality, also impulse control and emotion. There is an evidence that damage to this region is present in patients with schizophrenia, attention deficit hyperactivity disorders, and the obsessive compulsive disorder. The insula is believed to be involved in consciousness, and it plays a role in diverse functions usually linked to emotion. These functions include compassion, empathy, taste, perception, motor control, self-awareness, some of the cognitive functions, and the feeling of interpersonal experience. In relation to all of this, it is involved in some psychopathological conditions. The insular cortex is activated when drug users are exposed to environmental cues that trigger cravings. This has been shown for a variety of drugs, including cocaine, alcohol, opiates, and nicotine. The precuneus is some of the brain regions involved in episodic memory, visuospatial processing, reflections upon self, and aspects of consciousness. These significant regions make the significant networks, the significant brain networks, which concerning to the psychopathological conditions are three. These are the default mode network, the salience network, and the frontoparietal network. The default mode network is active when a person is not focused on the outside world and the brain is at wakeful rest, which is present during daydreaming and mind wandering. The regions which compose this network are the medial prefrontal cortex, the posterior cingulate cortex and the precuneus area, and the angular gyrus. This network can be also active during detailed thoughts related to external task performance. Also, it is active when the individual is thinking about others, thinking about themselves, and remembering the past and planning the future. The salience network consists of the two regions, which are the anterior insula and the anterior cingulate cortex. It is involved in detecting and filtering salient stimuli, as well as recruiting relevant functional networks. Together with the interconnected brain networks, the salience network contributes to a variety of complex functions, including communication, social behavioral, and self-awareness through the integration of sensory, emotional, and cognitive information. And the last one is called the central executive network or the frontoparietal network, which consists of the dorsolateral prefrontal cortex and the posterior parietal cortex. It is thought to be involved in substantial attention, complex problem solving, and working memory. The knowledge about these networks and these regions is very important, and the translational approach in neuroscience has initiated the inclusion of novel or modified unconventional diagnostic and therapeutic techniques with very promising results. For instance, neuroimaging datasets from multiple modalities provide insight into the nature of pathophysiological mechanisms, such as disruptions of connectivity from these networks, integration and segregation, focusing on the treatment of mental disorders through instrumental biomedical methods such as electroconvulsive therapy, transcranial magnetic stimulation, transcranial direct current stimulation, and deep brain stimulation, which are instrumental biomedical and psychosurgical procedures. And these methodologies have yielded promising results that have yet to be understood and improved to enhance the prognosis of the severe and persistent mental illnesses, which are schizophrenia and depression. And also, by combining the psychopharmacology methods and instrumental biomedical tools, we are able to neuromodulate the brain, and by this we will be able to integrate the results into the therapeutic framework using the various advanced instrumental biomedical tools. Thank you.
Thank you for the presentation. The questions will be asked at the end of the session, according to the advices before the meeting. So the next presentation, Amita Singaravellu is the presenting author. The topic is the health implication of the hypersensitivity reactions in administration of vaccines and the possible impact on COVID-19 vaccination. Please, you have the floor.
Good morning, everyone. I hope you're all well and healthy. Our topic is on the health implication of hypersensitivity reactions in administration of the vaccines and the possible impact of the COVID-19 vaccination. Okay, sorry, let me just check that this is, okay, perfect. So hypersensitivity is an exaggerated immunological response to an antigen or an allergen. There are 4 different types of hypersensitivity reactions, so type 1, 2, 3, and 4. Each of these are going to be differing in their outcome and their development and the immunological mechanisms that are going to be involved. So I have listed them out on the slide for you. In modern society, allergy has become a prominent concern in the growing population. There's been an increase in the hygiene levels, which means that the level of exposure to microbial agents, even from a young age, has decreased. However, such exposure is detrimental to the priming of the immune system, especially in children. The lack of exposure hinders the development of immunological tolerance to ordinary and common microbes, causing an increase in allergies. Immunologically, it can be seen that the activity of the T cells, and this is the regulated T cells, towards the allergens has decreased. Evidence suggests that immunization introduced into early life has potential to ensure protection against preventative diseases. So vaccines. Vaccines are an effective and efficient method in active immunization against certain diseases in order to decrease the death and the health complications which are going to be causing diseases. So vaccines are created by weakened or killed antigens which are going to be stimulating an immune response. So this initiates a production of specific antibodies to combat the antigen, and upon second exposure is going to be stimulating the memory T cells to be produced much faster, more efficient production of the antibodies. Even though allergic reactions from the microbial agents itself are rare, it's not really abnormal. It can be seen, for an example, in the DTP vaccine. So vaccines and allergies. So allergic reactions from vaccines are generally categorized into two. So they can be acute or delayed. In the cases of acute, the reactions are typically type 1 hypersensitivity reactions that can be seen. So they are immediate or a couple of hours in onset, and they are characterized by the production of IgE antibodies. They can develop into severe life-threatening anaphylaxis. It can be followed by multiple organ systems being involved. And it requires quite careful monitoring. On the other hand, delay type hypersensitivity reaction, which is going to be the type 4 hypersensitivity reaction, it's going to be occurring within hours to days after initial exposure. Some of the clinical symptoms can be delayed by up to 2 to 3 weeks, most commonly being rashes. So usually they are self-limiting and don't require the administration of a second dose. So with influenza and vaccine, so the production of the influenza vaccine took place previously in an embryonated egg. So what that meant is the ovalbumin would be present in the vaccine. And when this is administered into people, for an example, with egg allergies, this would arise with some issues. Nevertheless, the amount of people that would have egg allergies and have severe reactions to influenza vaccines in general are quite less. Nevertheless, it's important to bear this in mind just in case. So with COVID-19, so towards the end of 2019, a new virus arose in China, which spread across the countries, coronavirus, hence the situation we're in basically. It causes severe acute respiratory syndrome. That's why it's also called SARS-CoV-2. Coronavirus is transmitted between people through respiratory droplets and by the contact from other people. So what does this exactly mean? Vaccines are going to be the most effective method in decreasing the chances of someone getting infected by coronavirus in comparison to having the governmental plans, for an example, the social distancing, the wearing the masks and sanitizers. So vaccines not only protect the individual, but may also contribute towards herd immunity, so a collective group of people that are going to be immune. The primary reason for coronavirus vaccinations is so that the body is going to be already introduced to the antigen, so there's going to be a faster production of the antibodies taking place. They are going to be, so if there is second exposure, essentially, there will be more specific antibodies that are going to be produced. They're going to be much faster, and they're going to be remaining in the blood for a longer period of time. So the vaccine that we'll be talking about today is the Pfizer vaccine, as this was the first one to hit the market, and there's more research on this. So the Pfizer vaccine consists of an RNA molecule, and it's going to be transmitted through a lipid particle, which is combined with a polyethylene glycol, also known as PEG, in the step known as PEGylation. So this basically essentially means that the particle is going to be hydrophilic, which means that it's going to be increased in stability and lifespan. The immune system is stimulated by the RNA template of the spike protein. This results in the activation of monoclonal antibodies against the spike proteins that are native to the SARS-CoV-2. It's mandatory for this vaccine to be stored at minus 70 degrees, which is why it poses a lot of issues. The other thing is that the vaccines are given in 2 doses, with the first and second being at least 3 weeks apart from one another.
The time is limited up to 7 minutes. Are you going to finish?
Yes, yeah. The main concern was the PEG molecules that were going to be present. And with that being said, research has shown that PEG is stimulating the IgM and the IgG instead of the IgE, which is why it's causing some confusion. Clinical trials took place in America, but the issue with the clinical trials that took place was that there wasn't actually a lot of data to suggest whether the groups were represented well enough. For an example, those that had drastic reactions. Preventative measures. So from the clinician's perspective, it's important for us to make sure that we're with the patient for at least 30 minutes after the administration. And for people that have allergies to polyethylene glycol or anything like that, we need to make sure that they are not subjected to the vaccine. In conclusion, so the administration of the vaccine is paramount so that we can overcome this as soon as possible. And in this situation, the idea of prevention is better than cure by the Dutch philosopher is the best implementation that we can do as a society in order to overcome this pandemic. Thank you. Thank you.
Thank you, Amita. So the next presenter is Theodor Wolski, and he's going to talk about long-term effects in hemp, cannabis sativa, on the endocannabinoid system and the epigenome and the resulting effects. The floor is yours.
Good morning. My presentation will be on the topic of the long-term effects of delta-9 tetrahydrocannabinol in hemp, cannabis sativa, on the endocannabinoid system and the resulting effects on the brain and epigenome. My name is Theodor Wolski, and I'm a student at the Faculty of Medicine of the Medical University of Plovdiv. This work has been done under the careful supervision of Associate Professor Dr. Anelia Bivoarska of the Department of Medical Biochemistry at the Faculty of Pharmacy of the Medical University of Plovdiv. The endocannabinoid system is an ancient regulatory system that has to do with the normal development and functioning of the central nervous system, the immune system, and many others. Cannabis is a psychoactive drug that exerts its effect by binding to the CB1 receptors of the endocannabinoid system, which means that the interaction between the endogenous and exogenous cannabinoids remains very important even today. Cannabis use, as you can see on the graph here, has been on the rise steadily in the last 10 years, whereas in 2016 in Bulgaria, around 10% of the young adult population has used cannabis at least once in the year of 2016. The main objective of this review was to summarize what some of the long-term effects of chronically used cannabis could be, focusing on the brain. The endocannabinoid system comprises of the endocannabinoids, the CB1 and CB2 receptors, and the enzymes for their synthesis and degradation. As you can see here, these are the formula of the two main endocannabinoids, anandamide and 2-arachidonylglycerol, or 2-AG. CB1 and CB2 receptors are present on the cells of many tissues, with CB1 cells mostly present on neural cells, while CB2 receptors present on other cells, such as in the immune system, in the spleen, and others. The main physiological mechanism of the endocannabinoids is shown here. After stimulation of the postsynaptic membrane, anandamide and 2-AG are secreted in the presynaptic space, where they bind to the CB1 receptor, which is a G protein coupled receptor, and the cellular response is inhibition of the release of more neurotransmitter, thus playing a very important role in synaptic plasticity. Hemp is a remarkable plant from which more than 500 phytocannabinoids have been isolated. Of them, only 3, presented here on the bottom, have a psychoactive effect. These 3 are delta-9 tetrahydrocannabinol, or delta-9 THC, its isomer delta-8 THC, and CBN. Of these 3, delta-9 THC is the active substance in marijuana because it is with the highest affinity towards the CB1 receptor. In the long term, because delta-9 THC binds to the CB1 receptor with such great affinity, it causes the suppression of the CB1 receptors, which lowers its response to the endocannabinoids secreted physiologically. However, there is data that this suppression appears to be reversible after 4 weeks of discontinued use, which could provide possible guidelines in the treatment of marijuana addiction. Many long-term effects of delta-9 THC have been documented, with none of them being as much as those on the brain. As you can see, brain morphology, glutamate signaling, and dopamine signaling are most affected. Brain morphology, alterations here are present, such as decreased volume of the hippocampal cortex and increased functional connectivity in the forceps minor. Glutamate signaling is affected as well, with disturbed pruning of glutamatergic synapses and decreased secretion of glutamate. Dopamine signaling is also severely affected in terms of lowering of the response of dopaminergic neurons towards stimuli, which in clinical terms results in depression, lack of ambition, motivation, and likelihood for addiction increased. Risks of psychosis. Already in the early research on the topic, there was established a moderate association between cannabis use and development of psychosis. This association persists even when accounting for some risk factors such as use of other substances, genetic risk factors, and others. There are some hypotheses for why such an association may exist, the main one having to do with the alterations in the previously mentioned glutamate and dopamine signaling, which are also present as one of the most characteristic symptoms of schizophrenia. Another hypothesis has to do with the lowering of anandamide levels in the cerebrospinal fluid due to decreased gene expression of the genes for the enzyme for anandamide. This is also present in some patients with psychosis. The epigenome is an important molecular mechanism capable of preserving the changes in gene expression that have occurred due to the influence of the external world. THC appears to be a very important factor in this regard, with the younger the individual was when they were chronically exposed to THC, the greater the disturbance in gene expression. Studies in rats show that the rats that have been exposed to chronically exposed to delta-9 THC in their adolescent phase show increased heroin-seeking behavior in the later stages of development. Human studies show that during sperm analysis, apart from a lowered sperm count, the sperm of chronically cannabis-using men also shows disturbances in DNA methylation, especially in genes that have to do with carcinogenesis. Important is to discuss the potential heritability of these effects, which has been established in many studies with rats. In conclusion, psychosis and addiction are one of the most characteristic symptoms for patients with cannabis addiction, which can be explained by the particular density of CB1 receptors on the brain areas that have to do with these two factors. Important to discuss is also the risk for adolescents, who appear to be most affected by the negative effects. Many limitations exist, such as the discrepancies between animal and human studies, especially when it comes to the effect on brain morphology. There are many avenues, of course, for future research, which would be illuminated by the introduction of cannabis legalizing legislation, the trend for which appears to be present worldwide. Thank you for your time.
Thank you, Theodore. So the next topic is about COVID-19. Don't be sex, XY with SARS-CoV. The presenter will be Wai-Ho Chui.
Okay, I hope you can all hear me and see me today. So can someone just confirm that they can see the presentation?
Yes, we
Yeah,
can.
we see it.
Okay, right, thank you. Right, so today I want to be talking to you about COVID-19 and why it is more fatal for men. I'm doing this as a cooperative work between me and my supervisor, Dr. Velasca of the Biochemistry Department. And we're also here, we attend the Medical University of Plovdiv. So without further ado, I'm going to start. I hope you can see this table. This table is a table of statistics from SARS-CoV-1 in 2003 in Hong Kong. I want to bring your attention to this green box here. And here by my mouse, you might see the number 2.27. This is actually the relative risk, and it means that ages from 0 to 44, it is 2.27 times more likely for men to die from COVID. Here, at the bottom of the blue box, we see men, 170 deaths, women, 129. This is for SARS-CoV-1. A similar table, but this time showing MERS. And when we look at the notes right at the bottom, we see for men, a case fatality rate of 52%, and for females, 23%. And again, when we look at the death numbers, men 89 and women 31. Those were the two respiratory syndromes that were prior to COVID-19. And when we actually get onto COVID-19 itself, here in figure 3, we see that, again, we see a sort of similar pattern where men are hit worse than women. Only a handful of countries here only have a 1-to-1 ratio, a ratio where there's more women. And in figure 4, we see that there's actually quite a lot of, the ratios are again higher in men. So now I want to try and explore why this is the case. Why do we have this correlation? So SARS-CoV-2 binds onto the ACE2 receptors. Now these ACE2 receptors become vital because they actually control vasodilation and vasoconstriction. They also convert angiotensin 2 to angiotensin 1 to 7. This is quite important actually, because if there's a buildup of angiotensin 2, then this actually fully leads on to an increase in oxygen species. And one of the main organs that are affected by this is the heart. The heart is affected by oxygen species because it can build up in the infarct and peri-infarct regions. Also, when there's a loss of ACE2, you would have some matrix metalloproteinase 2 and 9. You can see this increase here in Exhibit A. Now, these will build up in the extracellular matrix in the heart, and it will then be degraded in the walls. Now, here in Exhibit C, you can kind of see the degradation and the effects of it. In the sham controls, we barely see any cracks in this ventricular wall. However, after myocardial infarction, you do see some cracks here. This is done by prochroserious red staining. Now, it's quite natural for after myocardial infarction to have it, but afterwards, as you can see in the controls, there is some difference. My reasoning as to why males have it more is because of immunity. Males having mainly a buildup of toll-like receptors 2 and 4, which recognize the pathogens from cell wall, and women having 3, 7, and 9. You can think of this as toll-like receptor 2 and 4 as CCTV. They can act as surveillance, but not really do anything, whereas 3, 7, and 9 are, they are like security guards. They can actively check each pathogen or the viral RNA and DNA. One of the more interesting facts is that there's actually quite a lot of TLR7 in women because it escapes X inactivation and thus triggers alpha interferons. And when I studied some more into Klinefelter syndrome, it was found that patients with Klinefelters had higher TLR7 levels and thus allowing for greater activation of the alpha interferons. The next thing I really want to quickly talk about is estrogen. In low concentration estradiol, we have the Th1 response, which increases IgM and IgG. However, in high E2 concentrations, we see a Th2 type response and humoral immunity, not cellular mediated like the other one. And this increases the interleukin-4 levels. It was also found that in transgender men who had received some estrogen therapy and androgen antagonists, that they had the ability to express more ACE2 receptors in the testicular cells, which reduced the buildup of angiotensin 2. And as a result of this, as I said earlier, there wouldn't be a buildup of oxygen species. Okay, so we've acknowledged that there's this pattern between men and women. I don't really like to use the word male and female because male and female, there's also behavioral patterns that are added to it. For example, men might smoke more, men might drink more. These sort of behavioral patterns I haven't taken account in this presentation because there's so much to talk about. But here, mRNA-1273, otherwise known as Moderna, it found out that there was almost no difference in adverse effects or immunogenicity after the dosages. And again, a similar result with AstraZeneca. There was no difference between the two. This brings me to my conclusion, really, which is perhaps having acknowledged this difference between men and women, we can exploit this difference so that when there is the next respiratory syndrome, we can use this information to create vaccines more quickly. I want to give my final thanks to my supervisor, Professor Bibilaska, and also my family and friends for their support. Thank you.
Thank you for the presentation. And I'm giving the floor to the next presenter. The topic is diagnostic imaging of lung changes at different stages of COVID-19 infection. Anna Vasilska will present this topic.
Hello.
Now, the floor is yours.
I'm Dr. Vasilska, and I will present you the diagnostic imaging of lung changes at different stages of COVID-19 infection. The COVID-19 infection spread worldwide and reached a pandemic stage with over 19 million people being affected. In order to detect the infection, we also use clinical examination, PCR, and imaging. The sensitivity of the imaging methods depends on the stage of the disease. It's very important for the radiologists to have detailed knowledge of the pulmonary changes, aiming to distinguish patients in the acute stage of the disease from those in the post-recovery. It's also very important for the asymptomatic course. The first stage is the initial stage, which is up to the 4th day after the first symptoms. If we perform a high-resolution computed tomography, there will be normally no lung changes in the parenchyma. However, we can perform an X-ray to rule out some other pathologies, for example, pneumothorax or pleural effusion, which will lead us for another disease, and we will send the patient for further examination. Then we have the progressive stage, which is from the 5th up to 8 days after the symptoms. Here, the first feature that appears are the so-called ground glass opacities, which actually represent the inflammation of the alveolar septa. They are also the most common feature that we can visualize on the high-resolution computed tomography. Normally, the ground glass opacities have a lot of etiologies. However, for example, those from pulmonary edema, for example, are mostly in the parahilar region. They are diffuse from the top to the bottom of the lungs, while the ground glass opacities in the COVID-19 infection are mostly with low density. They are bilateral in the periphery, subpleural in the lungs. We can have also one more feature here, the so-called crazy paving sign, which actually represents the superimposition of the thickened interlobular septa over these ground glass opacities. In this stage, the ground glass opacities have a low density. While in the peak stage, which is up to the 2nd week, the ground glass opacities will be greater and with higher density. Here we can also see consolidations, which means exudates in the alveoli, as we can see on this computed tomography. Also reticulations. It's known that the coronavirus combines with the angiotensin converting enzyme receptors and suppresses them which leads to the enlargement of the vessels in the lungs, which is also a very common feature. Some other rare features that we might visualize are the bronchiectasis, cavitations, pleural or pericardial effusion, and lymphadenopathy. The last stage is the absorption stage, which is actually after the second week. The first sign that is resolved are the crazy paving sign, which are followed by the consolidations and the disappearance of the later of the ground glass opacities. There are mainly two ways of healing of the lung parenchyma that we saw. The first is the healing without any consequences in the lungs. And the second direction is the formation of the fibrosis. In our practice, mostly in the patients with control high-resolution computed tomography, most of them had actually no consequences in their lung parenchyma a few months later. Nowadays, we use all available resources in order to effectively control the pandemic, which includes the clinical examination, PCR, and the diagnostic imaging, especially the high-resolution CT. It's very important for the detection, management, and follow-up of the patients affected by the COVID-19 infection. Thank you.
Thank you very much for this accurate presentation. The next presenting author is Sevdan Durmush, according to the list I have. The title is CT coronarography imaging of suspected ischemic cardiac disease, a case report of, I think, left coronary artery is the abbreviation here, narrowing. Am I correct? LCA?
Yes, good morning, dear colleagues.
Good morning. I'm giving the floor to you.
I'm sorry. So I have some problems with my camera. Is it possible to continue without?
Yes, it is.
Okay.
I saw you have 16 slides, so make sure you make them for 7 minutes, please.
Okay. So the topic of my presentation is CT coronarography imaging in suspected ischemic heart disease. So case a report of left coronary artery narrowing. Coronary artery disease is a serious condition that has been considered as a leading cause of mortality. So myocardial ischemia is a disorder that may cause stable or unstable symptoms of angina, cardiac arrhythmias, and less frequently shortness of breath secondary to ischemic left ventricular dysfunction. So we report a case of a male patient with suspected ischemic heart disease in the role of CT as a diagnostic tool. We present a case of 75-year-old male with suspected coronary disease. The patient has pain behind the sternum for nearly 2 months and also shortness of breath. He has dyslipidemia from the laboratory tests. Also, he is with concomitant arterial hypertension, 3rd grade. An electrocardiogram shows a normal sinus rhythm, left type, and transthoracic echocardiography demonstrates wall hypokinesis of the lateral wall of left ventricle, symmetrical left ventricle hypertrophy, ejection fraction 48%, and right cardiac cavities and pericardium without abnormalities. From abdominal ultrasound, we have fatty liver. So he has shortness of breath, and because of the pandemic situation, firstly X-ray and then plain chest CT scan is performed, and the results are normal. Then CT coronarography is performed on 64 slides CT with iodine contrast. And the coronary CT angiography results indicate atherosclerotic plaques with calcifications in the proximal segment of left anterior descending artery and in the proximal and middle segments of left circumflex artery. So here we have presented curved reformates of CT coronary angiography, demonstrating a normal right coronary artery, and here calcified plaques in the proximal segment of left anterior descending artery. Again, here we have presented curved reformates of CT coronary angiography, demonstrating this time calcified plaques in the proximal and middle segments of circumflex artery. So here we have three-dimensional images of CT coronary angiography. And the calcium-containing plaques are very well seen in these three-dimensional images. So oblique maximum intensity projection reconstructions demonstrating again the pathology and calcium-containing plaques in the left anterior descending artery and circumflex artery. So here we have shown volume rendered three-dimensional reconstructions showing the left anterior descending coronary artery. So here as well as the branch of the right coronary artery and the circumflex coronary artery. After the examination, invasive coronary angiography was performed, and the results from the CT coronarography and the invasive coronary angiography matched, and the invasive cardiologists reassess the patient and decide to continue with conservative treatment. So in selective cases, CT coronary angiography may be an alternative to invasive coronary angiography and the final test to exclude coronary artery stenosis. CT coronarography is a reliable modality for non-invasive evaluation of the coronary arteries. So having high negative and positive predictive value, this method is considered beneficial in patients with low or intermediate probability for coronary artery disease, and in patients with high likelihood of severe cardiac ischemia. Invasive coronary angiography is recommended as the most effective method of visualization of the coronary arteries and detection their pathology, allowing interventional therapy and revascularization. In these cases, CT should be considered to rule out alternative diagnoses such as pulmonary embolism or aortic dissection. CT coronarography could identify calcified and non-calcified plaques, high-risk plaques, the presence of positive remodeling, congenital coronary artery anomalies, and could evaluate coronary artery bypass grafts, their location and patency. But performing CT coronarography needs, firstly, patient's preparation, pre-medication in order to reduce the heart rate, often with beta blockers, because low heart rate is required at the time of procedure in order to avoid motion artifacts. Also electrocardiographic synchronization and at least 64 slice CT. What are the benefits and limitations of this method? This method is non-invasive. It could avoid potential complications of invasive coronary angiography. We have low dose scanning, short examination times, and dual source modern CT machines could avoid even electrocardiographic gating. The limitations include irregular heart rhythm, so the image quality is suboptimal in these patients. Also fast heart rates, more than 70 beats per minute. Severe calcifications, Most often, the presence of severe calcium could obscure the underlying lumen, rendering the imaging of specific stenosis unreliable. Another limitation is contrast nephrotoxicity and allergy to iodine-containing contrast. In conclusion, CT coronary angiography is an excellent method for detecting cardiovascular disease and more notably coronary atherosclerosis. This method could provide high quality visualization of the anatomy of the coronary arteries and is established as the preferred modality to exclude coronary artery pathology in patients with suspected ischemic heart disease. CT coronarography can identify vascular pathology to motivate prevention and facilitate treatment. Thank you very much for your attention.
Thank you, Sivjan. Now we change the direction with the next topic about basal cell carcinoma, a tumor with many faces. The presenter is Nevena Ilieva. You're welcome.
Hello, good morning.
Good morning.
Can we just skip to the next presenter because I haven't uploaded my presentation on the computer and I will be ready in 5 minutes.
Okay, let's we go further then with Theodor Wałowski once again, who is going to present two cases about hydrocephalus leading to significant alteration in the anthropometric indexes of the brain and the skull. Theodor, is it possible to start?
Yes, it is. Just 1 second.
Okay.
So, good morning again. This presentation will be on the topic of hydrocephalus leading to significant alterations in the anthropometric indexes of the brain and skull, a presentation of two anatomical cases. My name is Theodor Wałowski and I'm a student at the Faculty of Medicine at Biomedical University. This is a joint work with Dr. Marin Canare from the Department of Anatomy, Histology and Embryology at the Faculty of Medicine at Biomedical University. Hydrocephalus, this is a complex neurological condition with many definitions that presents as well as in children, as also in adults. There have been many different definitions for this condition, with all of them mentioning in some form or another an increase in cerebrospinal fluid volume, leading to an increase in the volume of the ventricular system as a whole. This is a case of pediatric hydrocephalus. The classification is another complex question. There are many systems of classification that have been proposed over the years, with the main one presented here focusing on the point of obstruction. Depending on this classification, one can classify hydrocephalus as either communicating or non-obstructive and non-communicating or obstructive. In communicating hydrocephalus, there is a free flow of cerebrospinal fluid through the ventricular system, and there are no obstructions between the point of production, the choroid plexus, and the point of resorption, the arachnoid villi of the arachnoidea mater. In the case of non-communicating hydrocephalus, there is an active obstruction somewhere along the course of the ventricular system as a result of malignant growth, some sort of inflammation, or other. As you can see, communicating hydrocephalus most commonly has to do with malabsorption of cerebrospinal fluid due to subarachnoid hemorrhage, meningitis, or other diseases. More rarely, but not exclusively, one can see that hydrocephalus can be the result of increased synthesis of cerebrospinal fluid. The etiology of this disease is complicated as well. One can classify hydrocephalus as congenital, acquired, or idiopathic. Congenital hydrocephalus presents in the neonatal period and is characterized with aqueductal stenosis. There have been many hypotheses for the pathogenesis of this type of hydrocephalus, some of them mentioning neuroinflammatory processes, some of them, the more new ones, have to do with the subcommissural organ and the secretion of sialoglycoproteins in the cerebrospinal fluid. Our recent discovery were also genes on the 18th and 22nd chromosome that have to do with the development of congenital hydrocephalus. Hydrocephalus can also be acquired. In this case, it is a result of a secondary pathological process. Idiopathic hydrocephalus, this is the case when there can be, where the cause for the hydrocephalus cannot be properly identified. A particular kind of idiopathic hydrocephalus is the normal pressure hydrocephalus. It presents with ventriculomegaly with no or just a small increase in intracranial pressure, as well as the characteristic Hakim-Adams triad of symptoms. These include dementia, gait disturbance, and urinary incontinence. In the case of all three symptoms in adult patients, in the more adult population above the ages of 80, one should suspect normal pressure hydrocephalus because it is a tricky condition to diagnose. During dissection on cadaver material in the Department of Anatomy, Histology, and Embryology of the Faculty of Medicine at Biomedical University, the following two cases of hydrocephalus were found. Case 1 is a case of communicating hydrocephalus in a child that is around 5 years of age. As you can see, there is visible dilation of the whole ventricular system present in all patients with hydrocephalus. There have been some interesting findings that have been established here. One of them is agenesis of the corpus callosum, which is not that uncommon because in 46% of cases, the agenesized corpus callosum presents with other morphological conditions of the brain and skull. As you can see, the whole volume and the head circumference have been markedly increased because, as you can see, the intracranial pressure has been increased, and because the patient is 5 years of age, this has led to significant macrocephaly due to the high compliance of the skull at this point of development. And according to the data of the World Health Organization, this data shows that the cranial volume and circumference are almost 100% larger than the marked indexes for that age. Case 2 is a case of communicating hydrocephalus in a child that is around 9 years of age. As you can see, there is present visible dilation as well, but less pronounced than in the first case. An interesting discovery here is porencephaly, a cavity in the right frontal lobe filled with cerebrospinal fluid that is in communication with the other parts of the ventricular system. A porencephaly is not that uncommon and also presents in some concomitant with other diseases such as the Arnold-Chiari malformation, Dandy-Walker syndrome, and others. Macrocephaly is present here as well because the patient is a child, but the cranial volume and circumference are less increased because of the later stage of development. However, due to the high intracranial pressure, one can suspect that the observed covariate thickening has developed as a compensatory response. You can see here a comparison of the anthropometric indexes of both cases. As you can see, the head circumference in case 1 was higher than in case 2, probably due to the earlier age of onset of the hydrocephalus. Same goes for the cranial volume. And important to note is also that in case 2, the thickness of the covaria is much increased due to the higher intracranial pressure in the later stage of development. In conclusion, hydrocephalus in children is the most commonly treated condition by pediatric neurosurgeons, having a frequency of around 1 in 1,000 births. One can expect different alterations in the anthropometric indexes of the brain and skull depending on the type of hydrocephalus and the age of onset. Important to note are other comorbidities such as morphological syndromes of the head and skull and the genetic factors that play a role in the development of this tricky to diagnose condition. Important to note is that the proper understanding of the classification of this disease will be vital for its proper treatment. Thank you for your time.
Thank you, Theodore. So, Nevena, is it possible now to start with your presentation, or it's necessary to go to the next one? Nevena? Okay, I suggest to move to the next issue about melatonin for healthy and peaceful sleep, but not only. The presenter is Atika Fijieva.
Yes, good morning, everyone. Just 1 second to start my presentation. I hope you can see my, no, or you can, 1 second. I hope you can see my screen now.
Yes, we can see.
Yes.
So my topic is melatonin for healthy and peaceful sleep, but not only. I'm Atika Fijieva from the Faculty of Medicine, and this work is with the help of Assistant Krasimir Bujanu from the Department of Biochemistry. So let's start from the origin and discovery of melatonin. Melatonin is a neurohormone called also the hormone of darkness because of its contribution to the circadian rhythms and its peak release at night. It is released in the pineal sites, the cells of the pineal gland, from the amino acid tryptophan, but also it was found that it can be released in the gastrointestinal tract and retina. Also, observations show that there is a synthesis of melatonin in other ocular structures such as the iris and ciliary body. Also, an interesting observation shows the connection between the intraocular pressure and melatonin levels, where intraocular pressure reaches its lowest levels at night, while melatonin levels are at its highest at night. So melatonin is first released around 6 to 8 weeks after birth, with peak release around 3 to 5 years, and then with a steady state phase. And through the years, it can be seen that there is a decline in melatonin synthesis. So the French philosopher Descartes describes the melatonin as the seat of the soul and the region where our thoughts are formed. In 1958, the dermatologist Aaron Lerner, while looking for a cure for vitiligo, discovered the hormone secreted by the gland, melatonin, so the name comes from there, from melanin, and tonin from serotonin. Let's start with melatonin synthesis. Its synthesis starts from tryptophan, which is converted then to serotonin and finally to melatonin. Through these reactions. So the regulatory enzyme is right here. It is AANAT, or arocylamine N-acetyltransferase, or simply serotonin N-acetyltransferase. This regulatory enzyme is mainly regulated by postsympathetic ganglion postsympathetic nerve innervation by norepinephrine, which binds to beta-1 adrenergic receptors in the pineal sites, cells of the pineal gland. Then it can be seen that cyclic AMP is being increased, which activates protein kinase A, and activated protein kinase A by means of CREB, or cyclic AMP response element binding protein, actually activates the regulatory enzyme AANAT. So lights actually decreases the melatonin synthesis by stimulating proteolysis of AANAT, the regulatory enzymes. But how actually our internal environment receives information about the day-night cycle? Well, our eyes have cells called rod cells and cone cells, as we know, but there are also other cells like ganglion cells, which have the photopigment called melanopsin. It is especially sensitive to short wavelength light, blue light, and melanopsin actually detects the light. Then the signal passes through these shown nerve pathways until it reaches the pineal gland, where the actually secretion of melatonin is inhibited. So actually in the cells of the eye, melanopsin, it can be shown that GQ protein receptors, right here, coupled receptors are being activated when there is light. So then phospholipase C is activated, and which follows the hydrolysis of phosphoinositol 4,5-bisphosphate, and thus we can see that the second messengers like IP3 and deacylglycerol appears. Inositol 1,4,5-triphosphate or IP3 increases intracellular calcium concentration, which leads to membrane depolarization, and thus the signal travels through down through the retinal hypothalamic tract until it reaches suprachiasmatic nucleus of the hypothalamus, then the paraventricular nucleus of the hypothalamus, then through the brainstem, through the spinal cord, and then to superior cervical ganglion, where actually it can be seen that there is a decrease in the postganglionic sympathetic nerve innervation, which leads to a decrease in norepinephrine. So the previous slide where we saw that this way the enzyme can be activated, here we see that if there is no enough norepinephrine, there is no activation of the regulatory enzyme, so melatonin is can now be synthesized. But darkness, on the other hand, actually activates melatonin synthesis. There are a lot of biological effects of melatonin here. Actually, I have just listed some of them. Melatonin has a role in adaptation to environmental changes and neuroendocrine effects. We know that melatonin has a really great role as it is an antigonadotropic hormone, and actually, the elimination of the pineal gland in kids leads to precocious puberty or pubertas precox. Also, melatonin has a similar antioxidant level effects as glutathione and vitamin E, which is especially important in brain tissue, where it actually declines the possibility of development of neurodegenerative diseases. And also melatonin has a role in immune regulation. It can be peripherally synthesized by the thymocytes, also leukocytes. Also, melatonin has a role in sleep regulation, circadian rhythms, as we understood, and melatonin has great impact on glucose homeostasis because there were found MT1 and MT2 receptors of melatonin in the islets of pancreatic islets, and so melatonin actually tells to the islets about the day-night cycle, and this way the secretion of insulin can be synchronized with the day-night cycle, which is very important, and actually a problem in this synchronization can lead to type 2 diabetes. And melatonin is actually a great and very important hormone with great significance because of its wide variety of biological effects, and so it is called hormone of darkness and hormone of youth. And there are a lot of things to be discovered, I think, about melatonin in the future. So thank you for your attention.
Thank you, Ati. So, about the presentation basal carcinoma, we ask Nevena Ilieva.
Yes.
Are you ready to present?
Yes, I'm ready. Sorry, I had some technical issues and I really apologize for that.
Okay, the floor is yours.
Do I share my screen? Can you see it?
Yes.
Yeah, we see.
So I will speak about the basal cell carcinoma, one tumor with many faces. The basal cell carcinoma is the most common primary skin neoplasm. It shows a slight predilection of the male sex, and usually it appears after the third decade. Risk factors for developing basal cell carcinoma are skin types 1 and 2, fair skin with red blonde hair, blue eyes, easy freckling, easy burn, never tan. Also chronic prolonged sun exposure, tanning beds, also some genetic disorders and radiation. The treatment is mainly surgical. Also, in some cases, topical treatment can be used, mainly imiquimod for superficial basal cell carcinomas. And for inoperable cases, radiation therapy is a good option. In past years, there is also a targeted treatment, Hitchcock pathway inhibitors, but they're used only for several cases. Clinically, basal cell carcinoma can appear like, usually it appears like thin pink nodule or papule, and it is very characteristic that you can see the translucent small blood vessels on the top of it, and in many cases they can have crust and ulceration. Some variants show like skin plaque or just skin ulcer, and we should not forget about the pigmented variant of basal cell carcinoma, which can mimic a melanocytic lesion. Histologically, basal cell carcinoma arises from the basal layer of the epidermis. It looks like nests from basoid cells, and the three most characteristics of the basal cell carcinoma are the peripheral palisading, the myxoid stroma, and the peritumoral clefting. Here I have put some of the most common histologic variants. The nodular variant is on the first picture. On the second picture, you can see superficial basal cell carcinoma. Characteristic for it is that all the nests are connected to the epidermis. On picture C, you can see infiltrated basal cell carcinoma, which shows nests and cords of basoid cells, which grow infiltrative and destructive into the surrounding stroma. And on picture D, you can see adenoid cystic variant. It's interesting because in the center of the nest, you have a pool of mucin. And now I will present the results from a study we conducted in Complex Oncology Center Plovdiv. We collected data about sex, age, size of lesion, localization, and histologic subtype, about from all newly diagnosed patients for 3 consecutive years, from 2017 to 2019. The number of patients was 1,303 patients were included. And regarding the localization, we divided the topographic regions as head and neck, trunk, upper and lower limbs, and genitalia. We subdivided the basal cell carcinoma in the following histologic subtypes: superficial, nodular, infiltrative, micronodular, basal, squamous, morphiiform, adenoid cystic, pigmented, and other rarer variants. And in red, I have showed the variants which we considered aggressive histologic subtypes. And for statistical analysis, we used Pearson chi-square. 54% of our patients were males and 46 were females. The mean age was 72 years, with the youngest patients being 23 years old and the oldest 93 years old. On the first graph, you can see the age distribution, and you can see that the majority of cases were among patients between 60 and 80 years old. Interesting to mention is that in the patient group under 40 years, 75% of the patients were women. On the second graph, you can see the distribution, the topographic distribution. Most of the cases were located in the head and neck region, followed by the trunk, upper limb, and lower limb. And interesting to mention is that all 4 cases in the genital area were among women. 154 patients were diagnosed with multiple lesions at the time of the presentation. The multiple lesions were observed more often in the male sex, and also the frequency of multiple lesions is rising with age. Here you can see on the second graph. Regarding the histologic subtypes, the most common was the nodular histologic variant, followed by the infiltrative and superficial variants. and the aggressive subtypes accounted for more than 28% of the cases. Regarding age and histologic variant, here on the graph, you can see that superficial histologic variant was most common among young patients, and its frequency declines with age, while for the nodular and infiltrative subtypes, it's quite the opposite, and their percent rises with the age. Regarding histologic subtype and localization, in the head and neck region, the predominant histologic subtype was the nodular basal cell carcinoma, whilst in the trunk, upper and lower limbs, the predominant histologic subtype was the superficial basal cell carcinoma. And as a conclusion, in the past few years, many researchers have proposed the theory that the superficial basal cell carcinoma has a different origin from the other histologic subtypes, and with our results, we confirm this theory because the superficial basal cell carcinoma is most common in young patients and in not so sun-exposed areas, which can show that the chronic sun exposure doesn't have such a big role for the superficial histologic variant. And because summer is coming, don't forget that SPF is your BFF. And thank you for the attention.
Okay, thank you, Nivena. So we move to hemodialysis patients and viral. No, the next presentation is about sarcoidosis, a short review and presentation of a clinical case with pulmonary symptoms. The presenter is Katerina Mikhailova.
Good morning. I will share my screen. Can you see it now?
Yes, it's okay.
Okay.
See it.
I'm Katerina Mikhailova, and I'm here to present you a case of sarcoidosis with pulmonary symptoms. I want to thank my team, Fotis Martiris and Dr. Manda Djeva, for our collaboration on the scientific work. Here you can see the contents of our presentation. I will start with some words about sarcoidosis, followed by the case report. Then you may learn more about the disease and the challenges of the diagnostic process. Sarcoidosis is a chronic inflammatory granulomatous disease characterized by granuloma without caseum, which more frequently affects the lungs, although multi-organ involvement is common. Changes in chest imaging are described at some stage of the disease in 90% of patients, more common as bilateral hilar lymphadenopathy and interstitial lung disease. The etiology is not fully understood, and the association between sarcoidosis and tuberculosis remains controversial. Our patient is a 28-year-old man from Greece. He presented with complaints of fatigue, dyspnea, and weight loss. He reported for a non-obstructive left nephrolithiasis diagnosed in February 2020. CT of the kidneys had been performed. It had showed a disturbing image of the base of his lungs. The nephrolithiasis had been resolved with medication treatment only. But in March, a CT of the lungs was performed with tuberculosis as a possible diagnosis. The T-spot came back negative, and the patient was referred to a hematologist because of a suspected lymphoma. A video-assisted thoracoscopic surgery was performed, and the results of the biopsy showed probable diagnosis of tuberculosis or sarcoidosis. In May, a standard follow-up procedure was requested for the biopsy material to be evaluated by a second pathologist who concluded on tuberculosis because of caseous necrosis with calcifications identified. Here you can see the results of the lung CT. There is a bilateral consolidation involving the dorsal segments of both upper lobes and partially the superior segments of the lower lobes. Thickening of some interlobular septa was noted. Numerous micronodules were found in the rest of the lungs, and multiple enlarged mediastinal lymph nodes. After the results of the second biopsy, a treatment for tuberculosis started. 2 months later, a new CT was performed, and it turned out that the treatment showed negative results. So tuberculosis was finally excluded as a possible diagnosis. And the probable one was a rare form of sarcoidosis, necrotizing sarcoid granulomatosis, where the presence of necrosis might be misleading. And in July, a treatment for sarcoidosis was prescribed, starting with 30 milligrams of prednisolone daily, and the dosage was high, so the patient was hospitalized with community-acquired pneumonia, and the dosage had to be changed. The results from the pulmonary function test from October and December showed significant improvement. You can see the change in the forced vital capacity and diffusing capacity of carbon monoxide. And we can conclude that treatment for sarcoidosis showed positive results. Here you can see all the additional tests performed, the results of them. The conclusion was that, fortunately, in this case, sarcoidosis affected only the lungs. Symptoms for other manifestations known, for example, ocular, renal, cardiac, were unfound. And the discussion about sarcoidosis, it is a systemic disease of unknown cause characterized by the formation of epithelioids and giant cell granulomas without causous necrosis. It had diverse presentations and no single criterion allowing definitive diagnosis. And that's why it remains a diagnosis of exclusion. It requires the biopsy finding of non-caseating granulomas not caused by any other etiology. In practice, a combination of clinical, paraclinical, histologic findings is used, and the exact etiology of sarcoidosis is unknown. The first reported association between sarcoidosis and specific gene products was the association with class 1 HLA B8 antigens. Subsequently, HLA class 2 antigens have been consistently associated with TID2. And there are more unidentified susceptibility genes. Sarcoidosis most commonly involves the lungs, eyes, and skin, so the search for environmental causes has centered on exposures to airborne antigens. And the cardio feature of sarcoidosis is the presence of CD4 plus T cells, and they interact with antigen-presenting cells to initiate the formation and maintenance of granulomas. This disease affects predominantly people between the age of 20 and 40, often women, showing high prevalence in Scandinavian and African American populations. Oral corticosteroids with usual dosage of 30 to 40 milligrams prednisone daily are the main treatments. Patients should be evaluated after 1 to 3 months for response, and those who fail treatment after initial corticosteroid therapy usually will not respond to a more protracted course. So in responders, the prednisone dosage should be tapered to 5 to 10 milligrams per day or to every other day regimen, and therapy should continue for up to a year. The course of the disease is variable, but spontaneous remissions occur in 50% of patients, and most improve with corticosteroid treatment. About 10 to 30% of patients have chronic or progressive disease. The conclusion is that diagnosis of sarcoidosis is sometimes long and difficult and can be misleading. There are forms that can lead to misdiagnosis of tuberculosis, so this leads to consequent delay in treatment. And sarcoidosis is a diagnosis of exclusion. Thank you for your attention. There are any questions?
The questions will be at the end of the session.
Okay.
Thank you for your presentation. The next is hemodialysis patient and viral hepatitis. Vanya
Yes,
Rangelova.
yes, thank you.
Are you here?
Good morning.
Good morning, very well. So the speech is yours.
Yeah, I hope you see my screen. So it is my pleasure to present to you today the results of a study that we have undertaken as a part of an intra-university project, which main goal was to determine the prevalence of the viral hepatitis E among risk groups, one of which are the hemodialysis patients. Viral hepatitis B and C are a widely recognized problem among the hemodialysis patient population, and these infections are still an important health and socioeconomic problem worldwide, despite the continued progress in their prevention and treatment. And in the recent years, there have been increasing reports on the importance of another hepatotropic virus, which is the hepatitis E virus. And in contrast to immunocompetent patients in whom the hepatitis E virus infection occurs as a self-limiting disease, in hemodialysis patients, the hepatitis E virus, the risk of chronification in those patients is much more higher. And at the same time, reports on the prevalence and possible nosocomial transmission of the hepatitis E virus in patients on hemodialysis are scant. The aim of the present study was to assess the prevalence of hepatitis B, C, and E infections in 3 hemodialysis centers in southern Bulgaria. During the period January-August 2020, 3 sectional seroepidemiological studies were conducted, covering a total of 229 patients from 3 hemodialysis centers in the Plovdiv region. And Center 1 was the hemodialysis department from the University Hospital St. George Plovdiv, covering 80 patients. And Center 2 and Center 3 are part of first dialysis service, as Center 2 is located in the city of Pazardzhik, and 33 patients were included from this specific center. And Center 3 is located in the city of Plovdiv, and 116 patients were prospectively studied. In addition to the serologic tests that were done among the patients for the presence of anti-HEV IgM and anti-HEV IgG antibodies, all the included patients were tested for the major markers for hepatitis B and hepatitis C infections, Hbs antigen and anti-HCV antibodies, and the tests were performed at the Laboratory of Virology, St. George University Hospital Plovdiv, and the National Reference Laboratory Hepatitis Viruses of the National Center of Infectious and Parasitic Diseases, Sofia. The hepatitis E virus is detected directly by determining the genome from blood or other clinical materials, or indirectly by the detection of specific anti-HEV IgM or anti-HEV IgG antibodies. In acute infection, the anti-HEV IgM antibodies occur around 2 to 4 weeks after the clinical manifestation and might remain for up to 4 to 6 months, sometimes even up to 12 months. At the same time, anti-HEV IgG antibodies occur almost simultaneously and may last for months, even for years, even a lifetime. Chroniodialysis patients are with relative immunosuppression, and in this patient group, the acute hepatitis E infection might remain undiagnosed due to the chronic uremia that might overlap with the symptoms of acute hepatitis infection. Among the 229 patients included in our study, HEV antibodies were discovered in 10% of them, and our results correlate with a previous study that was conducted in the Plovdiv region among the general population in 2012-2013, in which the prevalence of HEV antibodies was estimated to be 9%. Isolated presence of anti-HEV IgM antibodies was discovered in 6 out of the 229 patients included in our study, and anti-HEV IgG antibodies were discovered in 13 respectively. And simultaneous presence of anti-HEV IgM antibodies and anti-HEV IgG antibodies was discovered in 4 of the studied patients. The prevalence of HEV antibodies in the 3 different centers varied, with the highest prevalence in Center 3 with 11.2%, followed by Center 2 with 9%, and Center 1 with 8.75%. And regardless of the results from the from the serologic tests for the presence of anti-HEV IgM antibodies. According to the experts' recommendations for the diagnosis of acute hepatitis E infection, all the patients included in our study were tested for the presence of HEV RNA, and all the patients from our study were HEV RNA negative. 5.67% of all the patients included in our study were HBs antigen positive, with significant variations between Center 2 and Center 3 with 15% and 3.45% respectively, and the prevalence of HBs antigen in Center 1 was estimated to be 6.25%. For our country, the prevalence of HBs antigen is estimated to be around 4%, and our results correlate with this result from the general population. And the significantly higher prevalence of HBs antigen from Center 2 might be due to the small number of patients that were included from this specific center. The presence of anti-HCV antibodies among the studied population was estimated to be 7%, with very small differences between the 3 different centers, which didn't reach statistical significance. For comparison, the prevalence of anti-HCV antibodies in the general population in our country is estimated to be around 1%, and our results are significantly higher than this estimate. Due to the lack of a vaccine for hepatitis C infection, it seems that hepatitis C virus is the most common cause for chronic viral hepatitis among the hemodialysis patients, and this is one of the reasons why some authors rightly call this virus disease of the patients that are on hemodialysis. And in conclusion, interventions to reduce the prevalence of hepatotropic infections are essential to reduce the risks of long-term complications among hemodialysis patients, and our findings will be useful to the promotion of prevention policies. Thank you for your attention.
Thank you for the conscious presentation.
Thank you.
Well, the next presentation is on the anatomical area, a typical course of the median nerve in the axillary fossa. Ivan Sitnikov will be the presenting author. So we have the floor, share the screen.
Hello, good morning, everybody.
Good morning.
It seems I have some technical problems with my camera. Can you at least hear me well enough? Okay.
I think it's fine.
Okay, great. So our case report is on the topic of an atypical course of the median nerve in the axillary fossa, under the supervision of Associate Professor Dr. Nina Yotova from the Department of Anatomy and Histology. How do I? Okay. So, in our work, we present and describe variation of the course of the median nerve found in an upper limb of a cadaver in the Department of Anatomy during students' dissection. A bit about the anatomy of the median nerve and the brachial plexus. The median nerve is a branch of the brachial plexus. The trunk's divisions and the formation of the cords represent an important anatomical and functional differentiation. The median nerve is composed of fibers from the 6th, 7th, and 8th cervical nerves. As with most other nerves, the median nerve may receive contributions from the 5th cervical nerve above, or on occasion from the 1st thoracic nerve below. The median nerve is formed by the fusion of 2 large branches, one each from the lateral and medial cords. Here we can see another diagram of the brachial plexus. The 2 branches, alternatively called the medial and lateral roots, unite slightly below the level of pectoralis minor, anterior or anterolateral to the third of the axillary artery and lateral to the coracobrachialis muscle. This is equivalent to the surgical neck of the humerus when the arm is abducted to 90 degrees. Fibers in the lateral root innervate the palmar skin of the thumb, index, and most of the middle fingers, also pronator teres, flexor carpi radialis, and parts of flexor digitorum superficialis. The lateral root conveys most of the sympathetic fibers to the median distribution in the hand. The medial root, on the other hand, carries fibers to the skin of the medial side of the middle and the lateral side of the ring finger, and also fibers to palmaris longus, flexor digitorum superficialis, and the lateral part of the flexor digitorum profundus, flexor pollicis longus, pronator quadratus, and the median innervated muscles within the hand. Here we can see yet another diagram of how the brachial plexus is normally formed. The formation and relations of the three cords are variable and their designation somewhat misleading. The cords assume their appropriate relations about the axillary artery deep next to the pectoralis minor muscle. The fusion of the two roots from the medial and lateral cords most commonly occurs superficial to the axillary artery. Miller categorized variations associated with both abnormal compositions of the median nerve and pattern of the axillary artery. The artery and nerve have been found to develop in a concreted relationship to one another. On this slide, we can see our own findings. Also in the same study, Miller study of 480 brachial plexuses, conjoined arterial and neural variations excited in about 8% of the specimen. Of these, the most common variation was that the axillary artery was superficial to the median nerve, which is about 3.5% of the cases. So our own findings, as you can see with the blue arrow, this is the median nerve, and its conjoinment is the conjoinment between the lateral and medial roots, which form it, is actually posterior instead of anterior to the axillary artery. So what is the clinical significance of all that? Anomalies in the position and formation of the median nerve in the axillary fossa may lead to different and specific symptoms in the upper limb. Those can include paresthesia and hypoesthesia, also compression of the axillary artery with interfered blood flow. Atypical position of the nerve can also lead to abnormal position of the other elements in the axillary fossa, which may hinder nerve blocks in the region and other surgical procedures around the neck and the proximal arm. Wrong or misleading interpretations of diagnostic imaging can also be a possible result. And in conclusion, in patients with unspecific and etiologically unclear symptoms like muscle weakness, paresthesia, hypoesthesia, and others, abnormalities in the brachial plexus and the median nerve are not to be excluded. That's all from me. Thank you for your time.
Thank you, Ivan. So now we go further with the first poster, adrenal gland rim enhancement, an imaging prognostic factor in septic patients. The presenter is Magdalena Bilanova. Please keep in mind that you have 4 minutes for the presentation. Magdalena? Professor Delchev, is it possible to go further with the next poster?
Yes, of course. And there is a presentation maybe in Bulgarian, but we'll follow the order from the list. So e-poster number 14. Post-mortem destruction of the human body by animal activity. Case report. Liliana Mileva. Are you ready to present, Liliana?
Yes, I want to apologize. I have a problem with my camera and my computer. I just pressed it now, so I hope it will be okay.
There's some microphone problems. Check the microphone, please.
Do you hear me now?
No, it interrupts.
I'm sorry, I don't know what happened.
Okay, try again to turn it on.
Okay, now.
We can't see your screen.
Maybe continue with the next one. I will start my computer again.
Probably there is some connection problem.
Yes, maybe.
If you could connect to the internet directly via cable, or if you are using Wi-Fi, probably go closer to the router if that is possible, because I think that both the visual and the audio problems come from poor connection.
Okay, we can invite the next presenter meanwhile, and
yeah, I guess that
we'll
would be
try
best.
again to join the meeting. Well, the next electronic poster, congenital renal anomaly, horseshoe kidney case report, Mikhaila Georgieva. Mikhaila, are you in the meeting? Can you present?
I also don't find Mihaela in the meeting, so we could just continue to the next one and invite them later.
Okay. The next is maybe presentation according to the preliminary list in Bulgarian. Непредумишлен допинг, рискови и превенция. Христина Стойнова. Тук ли сте?
Добър ден.
На български ли ще представите?
Да, на български ще
Добре.
представям.
Заповядайте.
Само да потвърдите дали ми е споделен екрана и го виждате.
Да.
Добре.
Презентация, т.е. имате 7 минути.
Да. Непредумишлен допинг, рискове и превенция. Целта е да се анализира риска от непредумишлен допинг, като обобщена информацията от 55 проучвания. През 1999 година е основана Световната антидопингова агенция, чиято цел е да популяризира, да осъществява мониторинг и да координира борбата срещу допинга, като слоганът на тази организация е Play True или Играй честно. В Световният антидопингов кодекс много ясно са описани критериите, кога една субстанция или метод трябва да бъдат включени в забранителната листа. И това е когато повишават спортните постижения, представляват някакъв риск за здравето на спортиста или се нарушават спортните ценности, които са описани в кодекса. Като всяка година експерти от Световната антидопингова агенция изготвят списъци с субстанции, които се мониторират през следващата година и по този начин списъкът е постоянно обновяван и актуален. Като примери за забранени субстанции, това са анаболните стероиди и прекурсорите, а като методи можем да дадем кръвният или геният допинг. Професионалните спортисти са изложени на интензивни физически свръхнатоварвания ежедневно и за да обезпечат своите енергийни нужди е необходимо да се спазва точно определен хранителен режим и да се приемат определени хранителни добавки, но именно употребата на незабранени хранителни добавки не е напълно безопасна, тъй като крие реални рискове за професионалните спортисти. Проблемът с хранителните добавки е либералният режим на тяхната регистрация и производство. Причината за това е, че качественият и количественият анализ е пожелателен, но не и задължителен. И именно отсъствието на аналитичен контрол прави потребителите незащитени. През 2015 година възниква казус в Българския национален отбор по щанги. След положителни допинг проби на спортистите се анализират и хранителните добавки, които са приемали. В случая това е хранителната добавка Трайбест, която съдържа екстракт от трибулус. Тук се установява наличието на забраненият стероид санозолол и това е един от драматичните примери за дисквалифицирани спортисти следствие на положителен допинг резултат. Според Световният антидопингов кодекс, всеки атлет е длъжен да се увери, че в организма му няма забранени субстанции и носи отговорност за забранени субстанции, така и за техния метаболизъм, ако бъдат открити в неговата проба. Това е нарушение на антидопинговите правила и е без значение начина, по който субстанцията е попаднала в атлета, независимо дали е предумишлен или непредумишлен допинг. Какъв е рискът от непредумишлен допинг? Анализирали сме данните от 55 големи проучвания, проведени върху качественият и количественият анализ на хранителни добавки. Установяваме, че всяка седма хранителна добавка в даденото проучване е замърсена и най-често срещаните необявени субстанции, това са анаболните стероиди и прекурсори, като хидроепиандростерон, тестостерон, мандролон, санозолол и други. Друга необявена субстанция, която често можем да открием в хранителните добавки, понякога дори в 50% от анализираните хранителни добавки, това е сибутрамин. Сибутрамин в миналото е било лекарствено средство, което се е използвало за лечение на затлъстяване. До 2010 година, когато Европейската агенция по лекарствата спира разрешението за употреба на лекарствени средства, съдържащи сибутрамин, тъй като се установява огромен риск от страна на сърдечно-съдовата система с повишаване на артериалното налягане, очистяване на сърдечния ритъм, риск от миокарден инфаркт и дори смъртни случаи. В средно 20% от анализираните хранителни добавки можем да открием необявени субстанции, такива като ефедрин, псевдоефедрин, трамадол и кодин и други анаболни стероиди и прекурсори. Подходите за допинг превенция са образователни, като целта е да се повиши информираността на спортистите и техните близки, в това число спортните лекари и треньорите, с които работят, относно риска от прием на забранени вещества, и това може да се осъществи чрез образователни програми, интерактивни игри, книги, видеоклипове и гайдлайни. Хранителният режим на спортистите е много по-различен от този на нормалните хора. Необходим е приемът на хранителни добавки, които да помогнат за по-бързото възстановяване между тренировките и състезанията. Нашата препоръка е аналитичен контрол на всички хранителни добавки, преди да бъдат включени в режима на професионалния спортист. но анализите са скъпи и е лимитиран брой лаборатории, които трябва да бъдат акредитирани от Световната антидопингова агенция, за да могат да извършват скрининга на забранени субстанции. Законът в повечето държави не изисква предварителен аналитичен контрол на хранителните добавки, въпреки че над 20% от изследваните хранителни добавки могат да представляват потенциален риск за непредумишлен допинг. Най-често срещаните това са хипотрамина и пероралните анаболни стероиди, но приемането на хранителни добавки крие риск не само за професионалните спортисти, но и за обикновения потребител. А рискът от непредумишлен допинг може да се сведе до минимум, ако се прави скрининг на забранените вещества, преди да бъдат включени в режима на професионалният атлет. Аналитичният контрол върху хранителните добавки се очертава да е едно от предизвикателството на съвременните учени, тъй като постоянно се синтезират нови аналози на андрогени анаболни стероиди, така наречените дизайнерски стероиди, които все още не са включени в забранителната листа. Благодаря ви за вниманието.
Благодарим за презентацията, Христина, за придържането към времето също. Нека да проверим дали се решиха проблемите с връзката на Биляна Милева. Биляна, are you in the meeting? Can you try again? Post-mortem destruction of the human body by animal activity. Case report. Biljana Milieva, are you in the meeting? Maybe
I also don't see Biljana. I think she's offline, or she's at least not now.
Okay, we can invite the next e-poster, Michaela Georgieva, congenital renal anomaly, horseshoe kidney, case report. Michaela?
I also don't see Michaela in the meeting.
Okay, the previous presentation, Magdalena Bilyanova. She's not here too, maybe. Well, the next presentation на български за и против марихуаната в медицинската практика. Стоян Иванов.
Добър ден, чувате ли ме?
Чуваме ви. Презентация 7 минути. Заповядайте.
Само ако може да ми кажете дали виждате моят...
Виждаме, да.
За и против марихуаната в медицинската практика. Здравейте, казвам се Стоян Иванов, съм студент по медицина от втори курс. Моят научен ръководител е доцент доктор Анелия Биволарска от катедра медицинска биохимия към фармацевтичен факултет на Медицинския университет Пловдив. Растението канабис е познато още в древната медицина като болкоуспокояващо. Днес употребата му попада под рестрикциите на законите в различните държави. Възникват въпроси за неговото приложение в медицината като доказано болкоуспокояващо, но и като опиат. Възниква конфликт между етичните принципи за безвредност и благодеяние. Целта на днешният научен обзор е да се проучи влиянието на растението канабис сатива върху ендоканабиноидната система, редица болести и ползите и вредите от употребата му в медицинските цели. Масовата употреба на канабис и промяната на разбиранията за морал в обществото във връзка с развитието на науката изваждат на преден план въпроси за така наречените леки наркотици и имат ли те резон в медицината. Канабиноидите са молекули, които се срещат естествено и проявяват силен афинитет към канабиноидните рецептори на бозайниците. А това са делта-9 тетрахидроканабинол. Това е една от основните психоактивни съставки в канабиса. След активирането на рецепторите, ТХСЦ намалява синтеза на аденозин монофосфат, а това води и до намалена невротрансмисия. Увреждането на паметта, способностите за концентрация и пространствената ориентация също са наблюдавани ефекти при продължителната употреба на ТХСЦ. Канабидиолът, CBD, е другият основен фитоканабиноид, съдържащ се в канабиса. Основната му разлика с ТХСЦ е, че притежава интоксикиращи свойства. CBD има косвен ефект върху CB1 рецепторите. Канабигеролът има значителна антибактериална активност, канабинолът има седативни свойства, а пък тетрахидроканабинолинът има антипилептичен ефект. Синтетичните канабиноиди, ползи и рискове. Положението им в клиничната практика е насочено към облегчаване на позивите за повръщане, стимулиране на апетита и намаляване на болката. Два са познатите синтетични канабиноида в практиката. Това е дронабинол и набилонът. Дронабинолът е биохимично идентична форма на ТХЦ, а набилонът е аналог на ТХЦ синтетичните канабиноиди на пазара. Важно е да се подчертае, че употребата на нелегално синтезирани синтетични канабиноиди води до тежки психози, възбуда, повръщане, интоксикация и дори може да доведе до смърт. Тези вещества нямат никаква роля в какъвто и да е вид клинична терапия при пациентите. В почти всички страни, в които употребата на канабис за медицински цели е разрешена, е съставен списък с състояния, в които се допуска употребата на марихуана със специална рецепта от лекуващия лекар, а те са именно хронична болка, като това е едно от най-честите състояния, при които се изписва рецептурно медицински канабис. Според National Academy of Science, Engineering and Medicine на САЩ, при произведени 2 систематични проучвания, има значителни доказателства, че сместа от ТХЦ и ЦБД могат да повлияят хроничната болка много по-добре, отколкото само едно от двата фитоканабиноида. Въпреки това все още се знае изключително малко за дозата, която може да повлияе хроничната болка при пациенти. Скорошни проучвания сред HIV-позитивни лица, които употребяват марихуана, са доказали, че активният прием на двата основни фитоканабиноида може да ограничи репликацията на HIV. Също така да доведе и до смекчаване на възпалението и имуносупресията, свързани с него. Множествена склероза и мускулна спастичност, която излиза от нея. Комбинацията на ТХЦ и ЦБД имат прекалено ограничен ефект върху мускулната спастичност при пациенти, които страдат от това заболяване и няма никакви данни или те са прекалено малко за някакъв положителен ефект. Гадене повръщане след химиотерапия също съществуват убедителни доказателства, че орално приети канабиноиди помагат при симптомите на гадене и повръщане след прекарана химиотерапия. Здравните рискове. Редовната употреба на марихуана води до престрастяване, нарушаване в концентрацията, психози, отключване на шизофрения, увреждане на мозъчната дейност и е предпоставка за редица респираторни болести. Ежедневната консумация на канабис едно от причините за развитието на бронхити и обструктивна белодробна болест, също с намален обем на издишане, образуване на храчки и хронична кашлица. Инхалациите с парите при пушене на растителен материал имат бронходилатиращи свойства. Пътно-транспортните происшествия също тяхната концентрация нараства при хора, които са употребили канабис, но няма яснота относно дозата, която пречи на човек да шофира. Приемът на канабис води до отключване на различни шизофрении и други психози. Според шведските изследвания на Гарсия, някои от обектите, които употребяват ежедневно канабиноиди, са отключили такива шизофренийни разстройства. Акценти от последните събития в Европа. Те по-често държавите членки на Европейския съюз обсъждат плавен преход от пълна забрана за използване на канабис за медицински цели до контролиран достъп чрез програми, внедряващи канабиноидите като част от редица поддържащи терапии. Движение на регулациите. В 2017 година Германия променя своята регулаторна рамка за канабиса и на практика го узаконява, като създава Национална агенция за канабис, чиято дейност е свързана с мониторинг на производството, разпространението и осъществяването на различни обществени поръчки, свързани с канабиса. През 2018 година в Дания и Полша бяха предприети законови промени, които целят да определят програми за употреба на лекарства, които съдържат канабиноиди и които се използват единствено като поддържаща терапия при някои пациенти, а не като лечение. В Португалия стартира пилотен проект същата година, а пък през ноември месец Обединеното кралство под буен медиен интерес преминава към законови промени, засягащи канабисът. На лекарите разрешено да го предписват при редица състояния. През 2019 година във Франция е създадена работна група, която излезе с експертно становище за ползите на канабис сатива и фитоканабиноидите, които съдържа той, за редица заболявания. а пък в същата година Швейцария направи също някои законови промени. По-настоящем на пазара в Швейцария се предлагат разширено портфолио от продукти на базата на фитоканабиноиди. Законът за наркотичните вещества в Швейцария обхваща само продукти с концентрация на ТХЦ не по-голяма от 1%. За сравнение ви казвам само, че при държавите в Европейския съюз границата е 0,2%. През 2020 година нашата съседка Република Северна Македония също прие някои законови промени, като узакони някои лекарства на базата на фитоканабиноиди. Въпросът за използването на канабис и производните лекарства от него в медицината все още не е решен. Възникват много въпроси за безопасността, ефикасността, за избягване на възможната нерегламентирана търговия с това растение. Важно е да се подчертае, че няма яснота в каква концентрация на фитоканабиноидите може да се използва за медицината. Въпреки това, рисковете за развитие на редица заболявания са прекалено големи. Учените работят за установяване на точните дози в зависимост от индивидуалните потребности и характеристики на заболяването при отделните субекти. Етичните проблеми при узаконяването на канабис сатива също остават. Обществото реагира по различен начин на идеята за употреба на марихуана в медицината, като на практика улеснява или затруднява работата на медицинските специалисти в различните държави. Благодаря ви за вниманието.
Благодарим и ние, Стоян. Продължаваме с следващата постерна презентация. Тя е на тема остра токсичност на етерично масло от Танаситум вулгарен върху плохове. Христина Хараламбова.
Здравейте!
Здравейте! Имате 4 минути.
Да, ще коментирам на английски също така.
Добре.
Така, виждате ли ми екрана?
Да, вижда се добре.
Така, determination of the average lethal dose of Tarantetum vulgare essential oil. Tarantetum vulgare is a widespread perennial plant of the Asteraceae family. It is used in Bulgarian traditional medicine for treatment of parasitic diseases of the digestive tract, diabetes, and high blood pressure. The aim of the present study is to determine the mean lethal dose, or LD50, essential oil derived from Tarantetum vulgare flowers in rats. Tarantetum vulgare essential oil causes dose-dependent behavioral reactions and toxicity, such as reduced motor activity, asthenia, tremor, difficulty in breathing, polyuria, and gastrointestinal spasms. We used 30 male albino Wistar rats that were divided into groups of 6 animals. The groups were injected into the peritoneal with single doses of the essential oil as follows: 1,000 milligrams, 1,500 milligrams, 1,600, 1,800, and 2,000 milligrams. Behavioral reactions and mortality in the experimental groups were recorded up to 24 hours after the administration of the extract. Mortality at the 24-hour mark after the injections were as follows: dose 1,000 milligrams 0%, 1,500 66.7%, 1,600 50%, 1,800 milligrams was 83.3%, and the last dose of 2,000 milligrams, the mortality rate was 83.3%. The estimated lethal dose of Tarantetum vulgare essential oil in rats after intraperitoneal administration was 1,494.6 milligrams per kilograms body weight. According to the Hodge and Sterner scale, the essential oil of the plant is slightly toxic to experimental animals. And our results give us a future possibility to evaluate the effects of Tarantetum vulgare on the central nervous system, such as its effects on the memory, neuroprotective actions, and many others. Thank you for your attention.
Thank you very much.
Yes,
Професор Казакова, имате думата.
Ами да продължим с следващия постер, който заглавието му е дадено на български, но мисля, че ще се презентира на английски език. Това ще ни каже Вера Гледачева. Заглавието е взаимно повлияване на екзогенни невротрансмитери и изофилинови производни при въздействие върху изолирани гладкомускулни влакна. Вера, заповядайте.
Okay, I think that you can see my poster. Yes, so the object of our study is to newly synthesize easy-quinoline derivatives, structurally similar with papaverine, and we call them IQP and DIQ. During the research of the biological activity of these compounds, we formulated the following task: to observe the effects which IQP and DIQ have on the contractile activity of isolated smooth muscles following multiple consecutive administrations, and to research the mutual influence in reactivity between the examined compounds and the neurotransmitter 5-hydroxytryptamine, also known as serotonin, and acetylcholine. In our previous research, we determined the working concentration of 5 times 10 to the minus 5 mol per liter for the both studied substances. In this concentration, we check the capacity for developing tachyphylaxis after 4 consecutive administrations of IQP and DIQ, and also for papaverine with concentration 1 times 10 to minus 6 mol per liter. We did not register any significant tachyphylaxis after application with IQP and papaverine. However, following DIQ administration, we established there was a notable differences in the magnitude of pharmacological response right after the first application. All this led us to discern the mutual influence between exogenous neurotransmitter acetylcholine and serotonin on the IQP-induced muscle relaxation and the DIQ-induced contraction. Acetylcholine accomplished after IQP and after DIQ does not change the magnitude of its response. Regardless of the similar precondition, serotonin is significantly affected by the presence of IQP, and the tonic component of its contractile effect is reduced by almost 50%. This shows that IQP holds an additional ability that particularly affects the serotonergic intracellular signal pathways, at the same time without affecting the acetylcholine modulating action on the spontaneous contractile activity. And the relaxation of IQP significantly increased only in the presence of serotonin, whilst the DIQ contraction is significantly decreased only in the presence of acetylcholine. As a conclusion, we can say that despite all the similarities in the chemical structure of these two newly synthesized easy-quinoline substances, we have found significant differences in the influence over the character and strength of spontaneous contractile activity of rat's stomach smooth muscle preparation. These differences are characterized by opposing action as well as by specifics in modulating the levels of acetylcholine and serotonin. Thank you for your attention.
Thank you, Vera Гледачева. Благодаря. The next title is Molecular Anatomy of the Circadian Clock and its Clinical Significance, presented by Kasimir Avramov, but it is not indicated here, presentation or e-poster?
Hello, colleagues. It would be an e-poster.
E-poster.
Yes.
Okay. The floor is yours.
Just give me a second so that I'm able to share my screen and I'll be ready to start. Okay, are you seeing my screen now?
Yes, we
Okay,
are.
so as all of us know, we live on a planet that is governed by the diurnal cycle, which is caused by Earth's rotation. And this has led to the evolution of biological clocks in virtually all living organisms, including prokaryotes and eukaryotes, not only multicellular organisms. This evolutionary advantage gives us the possibility to anticipate the changes in the environment. And it had been repeatedly speculated in the past that an endogenous autonomous molecular apparatus was at play supporting the stability of the circadian behavioral and metabolic changes in the organism. In 1971, Ronald Konopka and Benzer induced mutagenesis in Drosophila melanogaster, and they managed to isolate 3 mutant strands that differ in the rhythmicity and the duration of their circadian rhythm. Perturbations were observed in the locomotor activity as well as the eclosion cycle of the population, and the hypothetical gene responsible for these alterations was named period. The following 50 years of research on the topic have illuminated the intimate mechanism in which this intrinsic property of the organism operates, and the advancements in the understanding of the circadian clock's molecular anatomy are formulated in the modern view of its functioning, which is in the matter of transcription translation based feedback loops. And you can see that on the figure that we have done together with Dr. Georgiev and Dr. Tyzyski. You can see actually 2 of those interlocking autoregulatory based mechanisms. And in mammals, the suprachiasmatic nucleus is considered to be the master conductor in the internal clock. And regardless of the exceptional stability of circadian rhythms, the precise temporal management of organ function is attained through the assistance of external cues, and these are known as Zeitgebers. In mammals, light is the most potent external cue, and the anatomical substrate for conveying the information from this cardinal cue is the retinohypothalamic tract, which origin is in a specific population of retinal cells. So, sine qua non principle of the circadian clock apparatus is a transcription translation based feedback loops, as you can see on the figure shown. The robustness of these mechanisms with oscillatory nature is maintained by 3 main interlocking autoregulatory loops using specific proteins' distinct property of regulating DNA expression. So the paramount negative feedback loop that you can see here, I'm not sure if you can see my cursor, is actually the loop that has to do with clock and BMO transcription factors that they induce the transcription of purr and cry genes. These genes give rise to increase in the concentration, cytoplasmic concentration of purr and cry proteins. So these 2 proteins can form heterodimers after binding with casein kinase, and they can translocate into the nucleus where they can inhibit their own transcription. So this is how the loop is closed, and this is giving rise to the participating molecular agents oscillation, which is observed in those patients. So the condition of familial advanced sleep phase syndrome is considered to be the first disease described in humans, which is in direct consequence of the primary impairment in this translational transcriptional feedback. So FASP patients show sleep phase patterns in cortical body temperature and melatonin rhythms that are 4-5 hours earlier than usual. In 2019, Zeman and colleagues proposed that the derangement of the circadian clocks are the unifying cause behind the tendency for clustering of the symptoms of metabolic syndrome, and the suggestion has been made for the existence of circadian syndrome. The circadian clock adds a temporal layer of transcriptional regulation to the genes being controlled, and this is critical for the organismal health, as it will be exemplified in the review. A considerable amount of indisputable data accumulates on the close correlation between properly functioning circadian clock and human health. And although chronobiology is still in its infancy as a science, it shows an enviable potential for strong influence on other medical sciences, as well as promising opportunities for decreasing the incidence of certain diseases, as well as improving their diagnosis and prognosis. Excuse me. That's all. Thanks to Dr. Georgiev and Dr. Tyzyjski for the help that they provided while making this review.
Thank you, Krasimir. Okay. Go to the next maybe presentation, I'm not sure, or e-poster. In Bulgarian, случай на фулминантен хепатит Е. Христо Милчев.
Ще бъде постер и ще е на английски.
Английски.
Добре, само да си шерна скрина. Така, виждате ли? Или още нищо не се вижда?
Още не.
Така, виждате ли?
Да, сега да.
Добре, така. Okay, so we should begin in English. First of all, I would like to thank Professor Komitova, Associate Professor Atanasova, and Professor Kevorkian for this opportunity. And to begin with a little bit of information about hepatitis E. This is an exotic disease associated usually with trips to Asia, and the most common genotype of hepatitis E is genotype 3, and exactly this genotype 3 has become a locally acquired zoonosis in Europe, and in some countries hepatitis E genotype 3 is the most common cause of acute viral hepatitis, and it is often asymptomatic, and usually it is diagnosed in older men. Some vulnerable patients are organ transplant recipients, and people who have chronic liver diseases usually can bear this burden of this infection, which often leads to severe decompensation of the liver function. And for the case, we have a 42-year-old man who was admitted to the infectious disease department in St. George University Hospital in Plovdiv with suspicion of hepatitis in June of 2019. His past medical history included some immune thrombocytopenia and spondyloarthritis, and you can see he had medical therapy, he had several drugs which he used. The patient did not represent any risk factors. He wasn't drinking alcohol, he wasn't smoking, and on onset of his clinical symptoms, he was afebrile, so he had no temperature. He was jaundiced with normal vital signs, and his laboratory tests showed severe parenchymal liver damage. From a serological point of view, he was initially tested for hepatitis A, B, C. He was negative. He was tested for cytomegalovirus and Epstein-Barr virus, and he was negative as well. So he was actually tested serologically for acute liver failure 1 year later by another team in archived serum, and here you can see that he was the serological method of detection was used to calculate the exact amount of the RNA of the hepatitis E virus in his bloodstream. So his disease course, initially he was jaundiced, and slowly his liver function tests progressively worsened, and this actually was needed excuse me. Okay, so first of all, he was jaundiced, his condition worsens, then he had a CT scan, which actually showed steatosis and ascites. And on the 7th day, his hepatitis actually evolved into acute liver failure. And here you can see on the picture on your right that his aminotransferases actually got lower and his bilirubin got high. So we have this cross-shaped figure. And because of this worsening of his liver failure, methylprednisolone actually was added, but to no improvement. And on the following day, the patient was transferred to another hospital in Sofia for further management and consideration for liver transplantation. Unfortunately, he developed multiple organ failure and died several days before the transplantation to be done, because donor was found, but the patient died, unfortunately. And why we did this study is because here you see a patient, a young patient, who was presented with an autoimmune medical condition and acute hepatitis C infection, thus fulminant hepatitis. And in developing countries, many pregnant women usually develop acute liver failure, and in most industrialized countries, in contrast, a very few cases of this condition have been reported. And it is yet unclear whether hepatitis E virus is the cause or associated with the liver damage. According to recent European guidelines, recommending is that all patients with hepatitis E should be tested using a combination of serological and molecular PCR assays. Ribavirin is the only established therapy for hepatitis C infection, and according to the European Association of Study of the Liver, ribavirin is a component of the treatment of chronic hepatitis E infection. Unfortunately, optimal treatment for hepatitis E, including acute liver failure, is not yet established.
Final words.
Yes, and in conclusion, the result of this study has confirmed that hepatitis E testing should be included in any initial acute liver failure. And I believe personally that molecular research may support clinical decisions and allow the use of better potential antiviral therapy. Thank you very much.
Thank you, Mr. Milchev. Well, we'll invite the other presenting authors, Magdalena Belyanova, who was not in the meeting before.
Сега съм тук.
Okay. Will you present in English or in Bulgarian?
I will present in English.
Well, the title is Adrenal Gland Rim Enhancement, an Imaging Prognostic Factor in Septic Patients.
Yes. Is my screen visible for all?
Yes, it is.
Okay. Hello, everybody. I am from the Department of Radiology of the Medical University Sofia, and today we're going to talk about 3 cases in our practice that made a big impression. The adrenal glands are deeply situated in the retroperitoneal space, but nevertheless they have a central role in homeostasis. Their location midway between thorax and abdomen means that they are present on most imaging studies encompassing these regions. Incidental adrenal findings are common in patients examined for other indications. Adrenal rim enhancement is an uncommon finding which is encountered in local processes such as adrenal gland inflammation, as in Addison disease and tuberculosis, an infarction, or in systemic conditions such as sepsis or shock. We report a series of 3 patients with sepsis of different origin who demonstrated adrenal enlargement and transient or continuous rim enhancement on contrast-enhanced CT. Patients were a 66-year-old woman with a perforated ulcer and peritonitis, which is the top case, a 65-year-old woman with a pelvic abscess, and a 41-year-old man with a lung abscess. All patients succumbed to their illness in the days following the examination, between 1 and 9 days after the CT scan was done, mean 4.6 days. Case 1 showed enlarged adrenal glands with transient peripheral rim enhancement in arterial phase and intensive and homogeneous venous phase enhancement with the density in the adrenal gland surpassing that in the aorta. Case 2 demonstrated slight rim enhancement of enlarged adrenals without significant increase in density between arterial and venous phase. And case 3 demonstrated peripheral rim enhancement and intensive and homogeneous venous phase enhancement, very similar to the first case, with the density very close to that of the aorta on venous phase. In conclusion, we state that adrenal enlargement and rim enhancement observed on contrast-enhanced CT in patients with sepsis could prove to be a prognostic factor for short-term adverse outcome. Thank you for your attention.
Thank you for the presentation. And we'll invite the next e-poster, Biljana Mileva. I didn't see her in the
Hello.
participants. You're here. Okay. Try to join again.
I'll try again. Thank you for giving me the second chance. Do you see the screen now?
Yes, it's visible.
We see the screen, yes.
Okay. So my name is Dr. Biljana Mileva, and I work at the Department of Forensic Medicine and Deontology in Sofia. So the first case is for post-mortem destruction of the human body by animal activity. After that, depending on the location of the corpse, indoor or outdoor, geographic conditions, season, and different type of insects, arthropod or animal, domesticated ones, stray or wild ones may invade the body. This could happen like immediately after the death or a few hours or a few days after the death, again, depending on the conditions, surrounding conditions. Post-mortem depredation may produce injury over the human body that can vary in size, shape, and localizations. And actually, those artifacts may be mistaken for traumatic injuries that are associated with blunt or sharp force trauma, and they may raise suspicions for eventual homicidal case. We present the case of a 90-year-old woman that was found dead early in the morning in the garden next to her house. According to the police report, the body was with severe injuries, as you can see from the pictures, over different surfaces of her body. They report as well that several rats were being seen in the vicinity of the house during the crime scene investigation. So they sent the body for an autopsy, and during the external examination of the body, again, as you can see, a large soft tissue defect on the face and the neck area was noted. The skin and the soft tissues were almost completely missing, and in some places, actually, the skull was partly skeletonized. With exposing the facial bones, which were actually intact. Similar injuries, as you can see, we noted in the both upper and lower extremity of the cadaver. The remnant skin margins were finely scalloped and serrated, as you can see on this picture on the closer view. The lesions were relatively dried, and no vital reaction such as bruising, hemorrhages, or anything else was noted in those injuries. In the depth of one of the injuries is not so well seen in this picture, but we found some rodent feces, which kind of helped to identify the perpetrator of these injuries. The toxicology was negative. According to the autopsy and histological... Do you hear me? According to the autopsy finding, that was attributed to ischemic heart disease and hypothermia. Post-mortem deprivation and scavenging by different animals are actually well-known phenomenon in the forensic pathology practice. Usually the post-mortem artifacts are situated, as in our case presented, over the exposed part of the body that are not covered with clothes. Those findings have to be carefully examined to determine the cause eventually, if they're ante-mortem or post-mortem in origin, sometimes those injuries can make difficulties in identification of the victim. And sometimes, as already mentioned, it can be suspicious for homicidal death. So thank you for your attention.
Thank you, Biljana. And we have the last presentation according to the preliminary list. Michaela Georgieva, the presenting author.
Actually, this would be me again because she is not able to present it. So
Biljana
Mileva, yes, again, I can continue with the next presentation.
Congenital renal anomaly, horseshoe kidney.
Horseshoe
Is this
kidney.
the same? Okay.
Yes, yes.
The floor is yours.
Thank you. So do you see my screen?
Yes, we do.
Thank you. So horseshoe kidney is one of the most commonly observed abnormalities with kidneys, which combines three anatomic abnormalities, which are ectopia, malrotation, and vascular changes. It consists of two renal masses that are connected at the level of their poles. The variations may be different. In most common cases, the abnormality consists of two renal masses that are fused at their lower poles by an parenchymal or fibrous isthmus. In rare cases, the isthmus connects the upper poles of the kidneys, and in this case, we have inverted horseshoe kidney created. Such fusion of the kidney occurs in approximately 1 of 400 to 600 individuals and is found more frequently in men than in women. We present a case of a 59-year-old man that was sent for an autopsy at the Department of Forensic Medicine and Deontology in Sofia. According to the police report, he was found dead in the morning at his apartment, and they had information that the previous night he was feeling sick and he vomited. During the standard and routine forensic medical examination of the cadaver's body, we established that the deceased was with horseshoe kidney with connection, as you can see from the picture, between the kidneys at their lower poles here, with thin layer of parenchymatous tissue. The pattern of arterial supply for each horseshoe kidney segment was the following. The upper and the middle segments were supplied by a single renal arteries, and then the arteries to the lower segment arise from abdominal aorta by a common trunk. We took samples for toxicology analysis and histology analysis to establish the cause of that. And in the end, after the results came out, the cause of that was acute intoxication with methyl alcohol. This study aims to present a congenital anomaly that could be a prepositioning factor for future renal failure. Horseshoe kidney is not a rare condition, but still is usually asymptomatic, which can increase the risk of unexpected complications as stone or infectious disease. There are changes in the normal anatomy of the kidneys, especially connected with the blood supply. There are different variations in the number and localization of the blood vessels. So clinicians and surgeons need to be aware of this type of congenital anomaly to diminish the potential risk for worsening the patient health condition. Thank you again for your attention and for giving me the second chance to be part of this.
You're welcome. Thank you. So as far as I can see, all topics, all titles and presentations were presented. Anything else? Did we skip anything, or everything was presented?
Everything was presented. I'm looking at the program now. So we have a little bit bigger pause now. So again, thank you also for the moderators for keeping it very smooth and strict and as it should be, and also all the participants. So now we have some kind of a bigger coffee pause thanks to that we were right on time, and we will be back at 10 minutes before 12. So we'll have like an hour and something now free for the next session.
What about the discussion?
Of course. Well, if there are questions, sorry, of course. If there are questions, we have plenty of time actually now for questions. So everyone is welcome.
In English or in Bulgarian?
Oh. Then the participants decide if there is a question.
В мен възникна така един въпрос към едната презентация на български беше за непредумишления допинг. Интересно, наистина. Христина Стойнова, ако сте тук.
Да, тук съм.
Да. Къде всъщност се публикуват резултатите от такива анализи на тези свободен достъп добавки?
Резултатите се публикуват в научните списания. Аз още на първият слайд бях изброила имената на Web of Science, PubMed и в научни списания с напълно достоверна информация.
А това дали води до някакви последващи забрани мерки от страна на БАБ? Видяхме там, че имаше наистина такава субстанция беше цитирана.
За съжаление, все още не води до такива санкции.
Да.
За спортистите, те са дисквалифицирани и е нарушена репутацията им, но от страна на производителите все още няма такива санкции, тъй като са хранителни добавки и при тях не съществуват гайдлайните за добри производствени практики, липсва контрол на качеството и затова все още не съществуват санкции към тях.
Да кажем, не че не съществуват, просто са по-скоро пожелателни. Има и хранителни добавки, които са сертифицирани по GMP, ако говорим за добра производствена практика. Въпросът е, че както и чисто административно и в България, и въобще в Евросъюза, самия режим на пускане на такъв продукт на пазара е много по-различен, отколкото при лекарства. И затова контрола е такъв на доста по-ниско ниво. БАБХ, доколкото аз съм запознат, понеже по най-друга причина съм ангажиран в този бизнес от 12 години с хранителни добавки, работи общо взето само по сигнали. Има, сега ако влезем в една аптека с вас, ще намерим гаранция, ще намерим продукти, които нарушават разпоредбите. Но те просто нямат ресурс да покрият достатъчно добре пазара и се работи само при подадени сигнали. А пък с непредумишлен допинг наистина е много сериозен проблем, защото понякога това замърсяване, както го наричат, всъщност би могло да бъде абсолютно целенасочено, злонамерено от страна на производителя, тъй като продуктът му по този начин ще бъде много ефективен и хората си мислят, че заради някакви добавки или витамини имат много добри резултати, а всъщност вътре има микрограми, а то е достатъчно от, да кажем, някакви деривати на тестостерона. И това е сериозен проблем. Сериозен проблем. Много беше интересна тази презентация, наистина и за мен.
Много добро допълнение, уточнение. Благодаря. Имате възможност за даване на въпроси, да.
Ако ми позволите, докато чакаме някой въпрос да възникне, бих искала да поздравя още веднъж всички участници, както и тяхните супервайзори, така и организаторите на събитието.
И разбира се, менторите, които се свършиха чудесно работата. Вече сме се съмнявали. Разбира се. И модераторите.
Благодаря. Наистина повечето от презентациите повдигат интересни въпроси и не бихме могли абсолютно към всички да се обърнем за дискусия, но това е работа, която продължава и за в бъдеще. Така че те са отворени за въпроси постоянно, предполагам.
Така би трябвало да е.
Ако се придържаме към правилото за 7 секунди или там някъде, ако не бъдат зададени въпроси, можем да обявим и приключването на сесията.
Абсолютно. И както да ви казах, значи 12 без 10 продължаваме с терапевтична сесия. След час и половина.
Благодарим на всички участници тогава. Thank you to all participants in this morning session, medical biological session. And see you soon. Довиждане, колеги. До нови срещи.